All right, it's time to talk with our featured guest, Joy Lantz. Joy, how's it going?
It's awesome. It's a wonderful Thursday. It's nice and sunny here in Chicago.
Oh, nice. Awesome. Where in Chicago specifically are you located?
I am in the south suburbs, so I'm coming to you from Mokina, which is near Orland Park.
Okay, cool. Awesome. Awesome. So to start
Yeah.
us off, Joy, for practice owners listening today, what's the one thing about your approach that you think will surprise them the most?
I think I'm going to bring a totally different layer into the practice that they've never even thought about before.
All right. So let's dive into that a little bit more. What specifically do you feel we kind of don't really think about as much?
I think we have a forgotten population in the dental world, and it's babies and toddlers. And I think it's because we're intimidated. We don't really know what to do, but there's a lot of parents out there looking for answers. There's a lot of parents out there who are tired of being on Google and asking chat all the questions that we should really have the answers for. I work with parents every day who come in with kids who are having all kinds of problems that we can really intercept and support parents with. And I think it's going to solve your new patient problems if you're willing to be brave and step outside the box and learn a little bit, and you'll have patients for life.
Interesting. So intimidated by babies and children, like specifically, what procedures are we talking about here?
My background's in hygiene. I'm a dental hygienist. And I remember the first time that I had a 9-month-old on my schedule when I was terrified because we don't see kids that age. I didn't know what to do with that kid. So I brought my boss in the back room and I'm like, what do you want me to say to this parent? The baby doesn't have teeth. Because at that point, that was my focus. The baby doesn't have teeth. What do you want me to talk to this parent about? I didn't feel good as a provider charging a parent for this exam when I really didn't feel like I had anything to offer. So I remember that day really, really well. And it was before I was a parent myself. And I think the shift changed once I had my own kids and we had our own struggles. And then I kind of got it. And all the pieces came together at that point.
Gotcha. Okay. So then that's when it started. Let's talk a little bit about your background then. Like that's when it started kind of changing for you. You started taking courses, or what happened to where you started getting more knowledge and executing on that knowledge?
For sure. So with my own kids, they had, as babies, issues feeding. They had terrible reflux. They were projectile vomiting. They were having issues sleeping. My daughter sucked her thumb till she was 6 years old. And as a dental professional, I'm just like, I knew it was bad for her teeth, but I really didn't understand the root cause of these things. I didn't understand why my son was spitting up all the time across the room. By the time I got to my third child, it took that long. So I started taking courses as a myofunctional therapist. So I am a board certified myofunctional therapist. And I really started with my hygiene background and then with this new knowledge, putting all those pieces together of understanding the why, not just being able to fix the problem, but understanding why it was happening to begin with. And that was really eye-opening, especially being a dental hygienist, right? Our focus is prevention. We want to prevent these things from happening. So it kind of made me wonder, why didn't I learn about this in school? Why didn't I know this stuff?
Interesting. So then if we rewind a little bit, what typically happens? So you're the parent, you're seeing this happen to your children. You can correct me if I'm wrong. I feel like you're unique in the sense of like, I got to figure this out. And then you went in to get the myofunctional therapy, you're certified. But what typically happens with providers and parents when this happens and they see this? Do they ignore it or do they just hope it goes away as they age, or what happens?
Yeah, that's a great question. So in the dental field, we typically, like my kids, even being in the dental field, didn't see the dentist until later in life, right? So my kids were seeing their pediatrician and the pediatrician didn't look in my kid's mouth. So a lot of pediatricians, and this is not a bash on pediatricians, right? Pediatricians, sometimes they're looking at a lot of different things. And just like all of us, me especially, I didn't know what I didn't know. I'm not bashing, but it is that sometimes. Like as a parent, you feel a certain thing in your gut about your kid, like something is wrong. And when I went to my pediatrician with my son, who was vomiting all the time, my pediatrician said, oh, he has reflux. we're going to put them on this medicine that's going to help. And I was a first-time mom and I didn't know any better. And I listened to my doctor and I put him on this medication. Now that medication was Zantac, and that is now recalled because it's a carcinogen. So I have a lot of mom guilt about that. And I feel like that's one of the big things that drove me into doing what I do. When you feel something is happening with your child, you need someone to validate that, not dismiss you, not say they're going to grow out of it. It's going to be fine. And my oldest is 24 years old, but I still see parents today where that's happening. Parents come in to see me and they've already been to the pediatrician, and the pediatrician kind of dismisses things just because they don't have the knowledge.
Interesting. So then talk to us, Joy, like, how do you know if the pediatrician is dismissing it or actually providing something that might be helpful?
You know, when I have parents and we talk to them for an hour for their consult appointment to really understand what's happening with their child. They come in telling us the stories. I feel like something's wrong. I went to my pediatrician. My pediatrician said, whatever, you know, it wasn't a solution. The problem is still here. I didn't know what to do. We found you. How can you help me? So we really dive deep into connecting what's going on with that child's mouth to what is happening symptom-wise and how it could be connected.
Gotcha,
So not everything is connected, but a lot of things are.
So the problem is still there. And then they go to you. Interesting.
Yes.
So I know you teach a 6-step milestone course from birth to, I believe, about age 3.
Right.
If a practice owner wants to roll this out tomorrow, okay, 6-step milestone, what's the first conversation they should have with their team? And what's the very first workflow change they need to make?
I think you need to get some really good education through wherever you choose to. I mean, I teach people what you're looking for. What are the things that you can see when a parent brings their child in that's going to tip you off? There's a red flag, like something's going on. There's going to be a lot of things that you can do within the office. There's going to be a lot of things that you're going to refer out for. But having in your office support and identify a lot of those things is going to be key, because that's going to help assist the doctor. I work a couple days in a dental office, and this is exactly how we run things. I'm the go-to person. I'm the one doing the intake. I do the consult, just like with a hygiene appointment. I do all the work, right? We go talk to the doctor. We let them know what we see, what teeth we need to look at. That's exactly how it goes with this. I'm talking to the parent. I'm pulling out the most important things, telling the doctor what we're seeing, and then she's able to come in and give the diagnosis for what we're going to do moving forward.
Interesting. So then what are the red flags?
There's lots. So for babies, some of the biggest things that we see are feeding issues, right? Not being able to breastfeed, having issues bottle feeding. It could be because of a tongue tie. It could be because they have low tone in their muscles in their mouth. They're not strong enough to do what they need to do. It could be actually something happening in their body. That's a big screening that we do. So obviously that's not something we are doing in the office, but if you have a baby that's all scrunched up, they're not going to be able to focus on feeding. And that is then in turn going to affect everything. So we kind of have this system where I go through these red flags, and some they have and some they don't. And then we move on from there. So that's more for infants. For toddlers, I mean, we've had some really bad situations where we bought all the bottles on the Target shelf to like get that baby to feed. But now they have to eat solid foods. And they don't have the oral skills to be able to do that. So they just won't eat solid foods, which means they're not gaining weight and they're not growing. It's a scary, big problem when you're a parent. You have a toddler who's not eating. Sleep is another really big one, which I know in the dental office, you know, we're looking at anyway, how a child is breathing. If they're open mouth breathing, that's going to change the entire craniofacial growth and development pattern. So there's really big things that we can be looking for. And again, like intercept these things early.
Okay, interesting. Can you give us the system for the red flags? I know you kind of mentioned there's a specific system that you do to identify the red flags specifically with infants. Is it like a checklist, or how does that look?
We have a parent fill out a big intake because, you know, parents know their kids best. What are they seeing at home? What are you seeing when the baby's eating? What are you seeing when the baby is sleeping? What are you seeing when the baby's breathing? So we have those kind of checklists to ask the parent. And then when the parent comes in with the baby, we're watching, right? Because sometimes parents, even though they're with the baby all the time, they might not notice things. For instance, I've had parents say, oh, my baby does not breathe through their mouth. I look at the baby and the baby's sitting there breathing through their mouth. So it's just not something maybe on their radar that they're noticing. After we go through all that intake, we do an examination of the baby's mouth. So we're checking even before they have teeth, right? What does their structure look like? Do they have a really high palate? Do they have tongue tie? Do they have other oral ties? What does it feel like when they suck on your finger? Is it strong? Are they able to sustain that? Or is it weak and they can't? So those are some of the things that we look for, because those are going to be the things that are going to affect how well they feed. And then the other thing we do is, with parent permission, I'll pick the baby up and kind of feel how the baby feels. Is the baby very tense? Is the baby able to lay on their sides? When a mother is breastfeeding a baby, we put the baby on their sides to feed. So if a baby is not comfortable on their sides, again, they're not going to be able to focus on a feed because they're uncomfortable in their body. So depending on what kind of things we notice, some babies we refer out for body work to go get loosened up before we do anything in our practice. Some babies don't need body work, right? Some babies can come in, and if they have oral ties, they can get those released. Those low tone babies that are really weak, they might need to see a feeding specialist before they come in and get ties released. So we are kind of funneling our patients into these supportive offices outside of our practice to make it more of a collective treatment. So we're holistically treating this baby, not just doing a tongue tie and sending the parent off like, hey, good luck.
Yeah.
We want that baby to thrive afterwards. So that's why we're looking at all these red flags ahead of time to set that baby up for success.
Awesome. So I can see like a lot of partnerships and good systems in place for this, especially with implementing it. So if we talk about it real quick, let's just say we're a part of it already. We're doing this milestone. Real quick, break it down for us. What is the course that you teach?
The first part of the course is called Baby Mouth, Toddler Mouth. That's really the foundational thing. So you kind of know what you're looking at. We might have learned a little bit back in school. This is in my hygiene books, but if you don't put it into practice, you don't really remember. You don't know what you're looking for. So it goes through all those red flag things. And then the second part of it is the milestone program. So it's distilling all that knowledge into then like a very systemized checklist of what you're going to be looking for and why, and how to explain things to parents. So that's the biggest thing, understanding it enough so when parents come in with questions, you're able to explain to them, why is it bad for a baby to mouth breathe? Why is it bad for a baby not to be able to manage solids? How is it going to affect their oral growth and their oral health? Because all of that will.
Interesting. So that's where the system for it is, that we can find it, right?
In the milestone part of things, right? So you can go through that checklist and talk to parents. And like you said, it's a wonderful way to build partnerships that you've probably never even thought of outside your practice, right? We have our network of endodontists and oral surgeons that we refer to. But what if you had a speech language pathologist referring to you? What if you had lactation consultants referring to you, or chiropractors? That's what I help practices do, like connect and make a network of people who understand what your position is as a dental office. And then you're reciprocating, what is the chiropractor's part in it? So you can work together to get the child where they need to be.
Yeah, because I was going to say, how do you market this? Like, let's just say we do it, we take it head on, we're part of it. Do we let our existing patients know, like, hey, bring your babies, or how does this work?
Yeah. Like through the program, I really love to start with prenatal moms, right? Like prenatal moms, we know have their own things happening, such as vomiting from being pregnant, or sleep not being so wonderful once you start getting larger and that baby's growing. It affects certain things with the mom too. So we support the mom, and we also support the mom with understanding what's normal and what's not normal with feeding a baby. Again, when you're a first-time mom, once you're discharged from the hospital, unless you have outside support, you don't really know what's normal and what's not normal. So going over those red flags with the parents, if you see your baby is reflux and has lots of vomiting, or has clicking when they're eating, or all the things that they should be looking for, then you might want to bring your baby in so we can do a screening and see what's going on.
So this can start like, let's just say the patient comes in and you notice, oh, you're pregnant, congratulations. Now is where it can start. What specifically would you start telling them so they can kind of continue with that procedure?
Yeah, I would talk to the parent, like the mom, about how to take care of herself throughout her pregnancy, warn her about all the things, like your gums are more than likely going to bleed, and that's from the hormones, and that's okay. And then, like you said, once your baby's born, this is how feeding should go. This is normal and this is not normal. So if you notice some of the not normal things, we can support you here. We can do a screening and then we can help you either by doing things within the office or by referring out to referral partners that we have.
Okay, I like it. I like it. So then the systems part. In practices already using your milestone system, what's the one, I guess you can say like tiny tweak you've seen create the biggest difference in screening effectiveness or parent acceptance?
I mean, parents, like I said, they're hungry for this. They're out there Googling stuff. I think within the office, it feels amazing to validate the parents. It feels amazing to have a mom in who feels something's going wrong. They're second guessing themselves. And you say, no, you're absolutely right. And this is why. It gives the confidence back to the parent. And not only that, like what we've seen is, oh, well, I have a 2-year-old at home. Do you see those kids? Oh, do you see adults? Depending on what kind of practice it is. The practice I'm in, I work with a general practice and I work with a pediatric practice. But it's going to bring even more people in, right? When you're educating parents on things that they've never heard anywhere else before, you're going to knock their socks off and they're going to want to bring their entire family into you by building that trust relationship with them and really being able to help their kids in a way that not a lot of people are doing.
I like that. How you're going to be able to build the trust with the whole family. I also like how you give confidence back to parents because I feel like that's all they really want is just certainty that they're doing the right thing for their child.
Right. I mean, and that's the biggest thing. If you're a parent, you never feel like you're doing the right thing. Having that validation, like, yes, what you felt in your gut is exactly right. And, you're in the right place and you found the right place to be. And being able to support them from, your first appointment where they're coming in and they're distraught and they're upset and they're seeing these things with their child and getting to our later appointments where they see their kids flourishing and they're eating and they're not having the issues that they're having. And it sounds hokey, but like you kind of change everyone's life, right? It's not just the baby, it's parents who are struggling. And if they have other kids and the baby's not sleeping and not eating, like everyone is just stressed out. So it really helps bring that home flow back to the household.
I like that. So then if we can transition a little bit, let's talk about the business and revenue impact that this could have on the practice. Sometimes owners hesitate to add new services if they don't see immediate financial impact. So from your experience, what's a realistic revenue increase or patient retention boost practices see within the first 6 months of adding these screenings and mile screenings?
That's a great question. I think it really depends on what you want your practice to look like. So if you want to start incorporating airway into your practice, this program is going to bring you lots of new patients because there's not a lot of people doing this. By keeping those patients within your practice, you're going to be able to track them throughout their growth and development. So if you're doing frenectomies in your office, you're going to have a built-in way to screen patients to move them into your frenectomy program, right? If you are doing early airway orthodontics and you keep a child in your program until they're 3, you're going to be able to move them into an orthodontic program early. And it's going to help funnel patients into your office by doing something like this and then bringing them into the other branches that you might have within the office. So that's the real perk, is doing something that nobody else is doing and then feeding other things to grow your practice.
I like it. You kind of retain them too as well. So if a practice wanted to turn these services into like their signature offering that differentiates them from other general practices or pediatric dentists, what messaging or positioning have you seen work brilliantly?
I think lots of community outreach. Moms have groups and they start to talk. Having really good, strong social media out there just to get the word out so people hear about you. But we have people finding us on Google. Just the more you do it, the more people talk, your name's going to get out there. And that's how you're going to get more and more people in.
Gotcha.
And like I said, just that internal family growth. Once you bring the baby in, now all of a sudden you have a whole family coming in. It's not just one person. They're so impressed with what you're doing that they want to learn more about their other children or themselves and what's happening. The general practice that I'm with, I'm doing the myofunctional therapy there. So when we have a baby come in and let's say they have a tongue tie, well, where'd the tongue tie come from? So when we do practice stretches, right, I'll show parents in their mouth. And then that's a great teaching tool because then I can show them what their mouth looks like. And then we start that conversation. Or are you having TMJ problems? Oh, are you having sleep issues? That's more than likely coming from what your structure looks like. And then that's a whole nother conversation and a whole nother potential treatment plan with the parent.
Yeah. Interesting. I like that a lot. So then lots of community outreach, the wording when it comes to that, the positioning on how we're going to like present it. Do we use myofunctional therapy? I don't know how many parents in the community really like know, to Google that. So would it be more like tongue tied, thumb sucking, things like that?
The way I position it is every parent knows how they bring their child to the pediatrician. If you have kids, you're going to the pediatrician on a pretty consistent basis, right? On those milestone visits to check their height and check their weight and check their head circumference, right? The pediatricians have their checklist of things that they're looking for. What I say, who's doing the milestone visits and checking within their mouth? Who's checking how they're breathing, how they're eating, how they're sleeping, which is pretty much all a baby does, right? So who's looking at that? That's our job. That's our specialty. The mouth is where we live. And if we can grab that baby early and really have it be a true milestone. I mean, think about pediatricians who see babies from the day that they're born until they're 18, 21 years old. Imagine having the longevity with that patient to be able to track everything from start to finish and have the interventions within your practice or referrals to be able to make sure that patient is as healthy as they can be.
I like how you mentioned that too. Like basically that's all they do right at the beginning.
Right.
So you're
Right.
the one who is looking into that. Awesome. So then team confidence and communication. How do you script introductions of airway or myo screenings so that parents don't see it as an upsell, but it's essential care? Like, do you have a go-to phrase or analogy that shifts their mindset instantly?
I talk to parents a lot about growth. Kids stop growing pretty early. Their jaws stop growing, in certain dimensions around 6 or 7. We see a lot of kids who have prepped canines or, teeth that just can't come out. So that's my biggest thing. I spent a lot of time with parents in that first consult talking about how oral growth affects their airway, which affects the quality of their life, literally for the rest of their life. Like we are setting up their foundation for the rest of their life. And that's pretty impactful, especially when we have parents bringing in kids who are struggling with themselves, sleep apnea, jaw problems, neck and shoulder pain. Those are the things we see with parents, which are pretty significant. So if you could avoid that for your child, wouldn't you do that?
Yeah, I like the wording. So then when a team member feels out of their depth talking about this, airway issues and mouth screenings, what's one mindset shift or resource you give them to build confidence fast?
I think everyone has to be on the same page. I do think that's really, really important. We don't expect our front desk team to know everything, but they do have to be able to answer questions. I love the Breathe Institute. So we did a ton of training with them with our own office. And then training the team as a whole is huge. The Breathe Institute has a ton of information. Dr. Zaghi is another doctor who does a lot of research on frenectomies and myofunctional therapy. He's very generous with his information. If you go to his website, there's about 28 tabs of all kinds of things that you can learn for free. Mm-hmm. And you will go down a rabbit hole to see all the connections with what we can do to help patients and how really critical this is to do this in the dental office.
Gosh, so team training, right? Basically. So would you say, hey, go to the Breathe Institute? Obviously, some are going to learn more than others. Some are going to know how to present it better than others in the team. Would your program also help with that?
My program is more geared towards littles, but I do help teams integrate things that they want to bring into their practice. So let's say you want a team member to learn myofunctional therapy, and then you want your team to be able to talk about myofunctional therapy. That's part of what I can do. You want to bring frenectomy protocols into your practice. I can help you put that together in your practice. When we have patients call our office, it's really critical to make that first connection over the phone. So we have patients calling, again, especially parents who are, like we talked about, they're stressed out. They don't want to kind of feel just robotic, like going through the motions. We have a team that really dives deep into asking the questions and talking to the parents and explaining what to expect at your first appointment and giving them just a little bit more love over that first connection to kind of get them set up to come in. I think that's really, really important. Having a front desk team who understands enough to be able to communicate that to patients is the very first step into that office.
So you kind of want to communicate like your love and care for them and their baby, but also like concern. And so when you're on the phone and they're talking to them, are you already running through that checklist, or are you just more trying to, hey, get them in here, let's check it out?
Yeah, what we do is we let the parent talk, and then our front desk, we're training them to take really good notes. When you pull up the chart for the day and you have baby John coming in, you kind of already know what the mom has said and what they're coming in with. And then they've already filled out their intakes. You can review all of that too ahead of time and make your notes for what you want to elaborate on when they come in.
So something you mentioned that I like a lot is referral and community partnerships. So you built strong networks with ENTs, lactation consultants, and other providers. What's one approach practice owners can use to initiate these partnerships without it feeling awkward or forced?
That's a really good question. So what I recommend is have an informal get together to really be able to meet people first, right? So you can feel them out and make sure you're on the same page. Like, make sure you have the same philosophy. There have been plenty of people that I've met through networking and we don't have the same philosophy, and that's okay. But I want to know that the people that, me personally and the people that I work with, that we're sending our patients to, that I would send my own kids there. Mm-hmm. That's really, really important. Another thing I recommend is taking the time to go and have a coffee or a lunch with the people that you really connect with so you can dive deep into protocols. If I send my patients to your office, what can they expect? And then vice versa. So you're very much talking the same language. When I refer you to Dr. Katie, she's going to do an evaluation. She will let you know how many appointments your baby's going to be seen for. She'll typically see you for a couple before this and maybe a couple after the procedure. Give them a little bit of preparation.
Okay, gotcha. And that happens with informal, casual introductions. And then from that point on, you kind of let them know a little bit more of, or you have like coffee time with them and stuff like that to keep like the relationship strong over time. Do you recommend
and just really good communication, hey, we saw one of your patients. Here's the pictures from their frenectomy. We also know what schedule, if we're doing tongue tie releases on a baby, we know that provider is going to see the baby, 48 hours after the procedure. So we're kind of volleying back and forth to make sure that family feels really supported between the practice and whoever else we're referring to, which, that's important too, to have seamless in the background things happening.
Do you recommend any formal agreements? Like, hey, this is a formal referral agreement. Can you sign this kind of a thing, or no? That's too.
I've never done that with anyone. I mean, I've been in dental 30 years. I don't know if anyone's ever signed an agreement with a orthodontist, I don't know.
There's no need for that then. Just casual.
I don't think so. Yeah. So just people you trust.
And I feel like you get that, like you said, through the vibe, in a casual, informal kind of setting.
Yeah. And the more you start co-treating and really having that communication on the patient, I have HIPAA compliant tech where I'll be like, hey, I'm sending you this patient. This is what we saw. Let me know what you see. Then they'll text me back. Yeah, we saw this, this, and this. This is what we're working on. We're going to take care of this before we send them back to you for the procedure. And then when you see the results and the parents see the results from, all of this work going into this, and then of course their child getting better, that's really what it's all about.
Yeah. So when we're talking about scaling here, if a practice wanted to transform into a center of excellence for pediatric airway or oral development, what's a non-obvious operational change they need to make that most owners overlook?
That's a good question. I think a lot of things with insurance can get sticky. There's a lot of billing and things like that you just might not even think about. I guess that's an operational change though, right? Non-operational, I think just really thinking outside the box, especially if you have kids yourself. What would you want from your own kids from a dental office that you've never even thought of?
I like how you mentioned the insurance part, because that is huge. So break that down for me, because I feel like that becomes a headache for a lot of us, or a lot of practice owners too as well. Is it normal? Is medical insurance involved in this?
Medical insurance is involved. So you have options. You can do super bills. You can hire a medical biller who can take care of everything for you. A lot of practices that deal with airway stuff are fee for service, just because then it doesn't have to be sticky, right? The patient pays the practice. practice either gives a super bill or has a medical biller on staff to take care of that for them, and then the patient gets reimbursed.
So the practice you work for, Joy, are they fee for service or are they medical? Okay.
Yep. And my office here that I work at, I'm fee for service as well.
So then how do you translate that to a parent if they're like, hey, do you take my insurance? I'd love to do this if you take my insurance, kind of a thing.
Yeah, that's a lot of where a really great response with your front team comes in. I mean, seeing our entire practice as fee for service, it's not like you're coming in for some things that are covered and some things that aren't. Everything's fee for service. We don't want the insurance dictating what we can and cannot do. If your baby needs this, if your child needs this, if you need this, and if it's enough of a pain point, I mean, I would say we have 95% of patients happy to pay out of pocket. There are very few that walk out and never come back.
Interesting. I guess it's easier that way, right?
I feel like the more you're established too, people know coming in what it is, that it is fee for service. They're told over the phone that it's fee for service. They're told before they even come in, this is what your consult's going to be. It's going to be out of pocket. This is what the procedure, here's a range it might be. It's out of pocket. This is the thing when parents are struggling so much with the kids and you've been down every road and you don't know where else to go or what to do. And a mom in a Facebook group said, hey, this office is pretty great. I don't know. Like, I feel like sometimes we're a last resort and that's kind of where they get a lot of answers.
So would you say this is kind of like a hidden challenge, the insurance? Like what's a challenge practice owners don't even realize they'll face when adding these services? And how do you preemptively address them in your coaching?
I imagine it could be, depending on where you're at and where you live. I've coached some pediatric practices who just incorporate the milestone program into a prophy appointment. And it's just setting the bar a little bit higher for what they do to attract more people. In fee-for-service practices, they'll charge out the milestone visits separately. So parents pay for that separately. So it's really up to the practice owner. You could start one way and shift things once you start to grow. We have practices now that take insurance and they want to shift to fee for service. So you can adapt. You can change things as the landscape changes, but you can really make it look however you want it to look, depending on how your practice wants to be run.
Okay, I like that. So is there a common mindset block among owners themselves that limits the growth of airway and myo programs in their practices?
I think staffing. I think everyone is just dealing with staffing, which is tough these days. I will say for me personally, once I transitioned from hygiene into myofunctional therapy, and I'm also currently in IBCLC, so I'm a lactation consultant as well. It totally changed my mindset. All of my knowledge from my years of doing hygiene has supported what I do with myofunctional therapy and lactation, because I understand the muscle so intricately. I know how things work. And it's tricky, right, with staffing. But there's so many staff, I feel like, these days that are burnt out too. So maybe if you gave your staff maybe an option to say, this is something that we want to build, feel them out. How do you feel about that? Are you ready to move on from hygiene? Are you ready to maybe have a different shift in your career?
I like that. Maybe they might be. It's interesting. Kind of gives them a little bit more of a tier, right? Kind of a thing and something to reach for and purpose as well, fulfillment. So it's interesting. Can you share, Joy, a story of a practice owner, because you worked with quite a lot. So a practice owner who almost failed implementing your system, but turned it around, and what exactly they changed to succeed?
I'm working with one right now, and hers has been a total staffing issue. It's just really hard to find the right person and to retain that person, right? So one of her staff members was going to take it on, and then she got pregnant, had a baby. Great, growing her family, that's wonderful, but that puts a wrench in things. And she had another person that was going to come in, and then that didn't work out. And now she has found someone that's going to take it over for her. So I think just finding the right person is integral to making sure that this is going to be successful in your practice.
And you guide us through that process, right?
Of course.
Okay, nice. And so one of the last questions I want to ask you, Joy, is if you could build your own practice from scratch today, with everything you teach, what would it look like operationally, culturally, and financially?
I would love to see practices that incorporate all different disciplines under one roof, so parents don't have to run around. I will say that that can be a barrier. If we're in a dental practice and we have to send you here and here and here, it can be overwhelming for the parents. So I would love to see one building with a dentist, a lactation consultant, a myofunctional therapist, a body worker. And if you need any of that, you can just run upstairs and get that taken care of at one place where everyone has the same mindset and everyone is kind of working together. And financially, I mean, I love fee for service. I would love it to be more affordable for parents too, though. I wish insurance would recognize how important this work is and how you would probably pay out less in the future if you just paid up now and made it accessible and affordable for parents to do these things. Culturally, I mean, the dental office I'm with, it's a pretty awesome place. We are all on the same page. We all are very passionate about this work. I think it's cool when offices kind of have an offshoot. There's a lot of dental offices where they have their restorative and their hygiene in one section, and then they just build a whole separate center for, tongue tie releases and that kind of support. So I think that's awesome too.
Awesome. That sounds beautiful. Yeah. Wonderful, Joy. Thank you so much for being with us. It's been a pleasure.
Sure.
But before we say goodbye, can you tell our listeners where they can find you?
Yeah. So I have my own practice in Mokina, Illinois here. My website is oralfunctions.com. You can learn about my personal services there. But if you're a practice and you want more information, you can find me at joylantz.com. I have lots of information there and you can learn more about what I do.
Awesome. So that's going to be in the show notes below. And Joy, thank you so much for being with us. It's been a pleasure, and we'll hear from you soon.
All right. Thanks so much.